Hey, this is Dr. Goodwin, your vet cardiology concierge, talking to you again. I get questions from a lot of vet students. How do you choose if you should specialize or if you shouldn't specialize in veterinary medicine? And it's a really great choice. Mentally, for me, I think every area of veterinary medicine is its own specialty. So I would never say, oh, I'm just going to be a GP. General practitioners have one of the most important jobs there is. They are the first line of defense every day, seeing these patients and helping people get sent to where they may need to go if the general practitioner doesn't take care of themselves. And that can be a huge, huge asset. So never think that's not a specialty in itself. Aside from general practitioners, you could go and decide, hey, I have this love just for surgery. I want to cut and cure, and that's the way I want to go. And that's an option that many people take. That's one of our larger specialties. Another large specialty is internal medicine. It's kind of a broad scope, and it covers basically endocrine disease and gastrointestinal disease, and a lot of times a lot of pulmonary diseases and kidney diseases, hepatic liver diseases. So there's a lot of options in there with internal medicine, and you can find ways to find an area that you enjoy spending more of your time in. Some people like ophthalmology. You know, the eye is fascinating. Other people get freaked out about eyeballs. You know, they're like, don't touch it. Don't touch it. And it's fine. I understand. I don't touch it. But I'm saying that all to say, you could have a great time seeing a lot of patients and helping them with their ocular difficulties. You know, I don't know of something more rewarding than having a dog that comes in blind that walks out seeing. Then there's always neurology. Neurology, the study of the brain, which is one that I personally loved a lot. Neurology, where you're always trying to figure out the puzzle. What's exactly going on that's causing the certain things to happen that we're seeing now? What little small spot may be resulting in this dragging of one leg or a stiff gait in another leg? That puzzle and finding out the answers to that puzzle can be highly rewarding if neurology is where your calling is. Of course, there's always cardiology. We keep the beat. You got to have rhythm, keep the pulse. That's how we do. Cardiology is one where you have a lot of highs and a lot of lows. Cardiac patients, if you find them and they're in a good spot, they can live a happy life and have no problems at all. Versus if the heart's really starting to fail, it can be a very stressful and very sad time for owners and doctors alike. So it's a very high reward, high risk, high reward type situation in cardiology. Aside from that, there are specialties where you don't really have to deal with the animals directly. There's pathology or radiology, where you're either seeing images that are passed from the animal or you're seeing tissue samples from the animal. So there's a myriad of ways that you can go in vet med and explore and find the one that fits you the best. There's a spot for everybody in vet med. For me, I found my love in cardiology when I was doing my internship. And we would work from 7 in the morning to about 8 or 9 at night. And the day would just fly by. It never felt like work to me. And I think that's the gift that we have in vet med. You can find an area to work in, to be in, that doesn't really feel like work to you. And if you could work a day without feeling like you're working, I'd call that a successful day. It's hard to beat something like that, getting to do something you love and enjoy every day. This is Dr. Goodwin, and if you want more content like this, please hit like or subscribe, and we'll talk to you soon.